Thanks so much for joining us for another edition of KFFB's Open Mic program. And we do have LaShannon Spencer. She has been on the governor's news conferences for this COVID-19. She is the Chief Executive Officer of the Community Health Centers of Arkansas. LaShannon, thanks so much for taking time and talking with us.
Well, more than anything, not so much taking time. Thank you for allowing me the opportunity to be on your show. And I bring greetings to your listeners across cities that you serve, and not just the cities that you serve, just that national listening audience that you have just as well.
Well, you know, one thing we got to talk about, and that is everyone around the cooler. We always say cooler talk, what people are talking about. Right now, people are watching very close as we're doing 7,000 tests yesterday. It's unbelievable. I was there when they did 150, and we thought we got to increase tests back in early March. Well, we're at 7,000. That means they told us the testing will increase positive results as well. And part of that is the partnership that the governor asked for the clinics, that's the community health centers and clinics throughout Arkansas, to come in and help with this battle of getting the test done. And that's what you guys are doing.
Absolutely. We stand in support with the governor in ensuring that everyone, regardless of where you live, at every corner of our state has access to a COVID-19 test. When I say have access, that's offering free testing for everyone, regardless of their symptoms.
Now, one thing we look at, and maybe you can explain for the listeners, because there's a lot that are apprehensive of even watching the news because it seems like we're skyrocketing on results and positive cases, active cases now. Can you address that a little bit of basically what we've been saying it's going to come?
But for those that, continue to follow the news and listen, when we first heard Nate Smith, Dr. Cam Patterson, Chancellor of UAMS, and other healthcare folks here in the state and outside the state, they talked about the peak, and they also talked about the different ways asymptomatic. So we knew the rise in positive numbers was going to occur, but we just wanted to make sure that we're trying to take every preventive measure to ensure that we're able to control the spread and ensure that everyone is given access to a test.
And explain how that is going with the community clinics throughout our listening area and throughout the state.
Well, it's going extremely well, and we have 2 health centers that are close in proximity. We actually have Boston Mound Rural Health Services, and we actually have Our Care. Even though people may not have a physical health center there, we believe in going and partnering with other entities, other organizations, regardless if we don't have a site there, to be able to offer testing services. That is truly important to us because community health centers plays a positive impact in the lives in every corner of Arkansas, and through our quality and comprehensive care services, community health center workers are on the front line working tirelessly to ensure that access to medical care services is there for sometimes our hard reach area residents.
Okay, and that's one thing that you can look at. It's some of the cities, maybe they don't have a health clinic, and that is what you guys are tackling, those cities and small communities that those folks can't get out and be tested. What do they need to do to find out if it's coming to a church or a community center near them?
What they can do is actually we have people are more than welcome to go on our site. That is chca-ar.org. Again, that is Community Health Centers of Arkansas, CHCA, and pull up, and you're able to actually see the different sites across the state or where testing is available. We also actually have a 800 testing hotline number, and that number is 1-833-508-0774. Let me say it one more time for you. Our testing hotline number is 1-833-508-0774. That hotline is manned 24 hours a day by a clinical staff person. If you're looking for the closest testing site near you, dial that number or go to our website, that's chca-ar.org, and you can find the closest testing location.
Now, what can a person expect when they go get a test? Kind of walk them through so they kind of have an idea what to expect when they do get there.
Well, when they first get there, they're going to be greeted with open arms and within a smile. That is just the staffing model. We take patient satisfaction, patient engagement very seriously. So they're going to get that warm smile, regardless if it's through a tent or through a drive-through or at a health center for the COVID-19. They're going to have to complete the necessary questions. Again, this is a free test. So, your financial information will not be asked, but just got to make sure you provide us with the correct phone number to ensure that we're able to call you back once your results come back. You're going to get a test. Some locations are offering free lunch, free snacks, free giveaways, but you are going to get the best possible care when you actually go to one of our health centers for tests.
Now, when they get the test done, does that also tell them if they have the antibodies? Is that something that's going to be that detailed?
It varies from location to location. Some of our sites are offering the antibodies, some are not. But when they call the hotline, they can definitely ask that question on which particular sites are offering the antibody testing.
And LaShannon, I want you to explain that to those that just said, what in the world are they talking about? Explain the difference between just being tested and check on the antibody. That means they may have already had it, correct?
That is correct. The antibody testing means that you can already have it. It can be passed through. The antibody testing checks your blood, and it's looking at the antibodies, which can show if you've been past infected with the virus that causes COVID-19.
There's so much information we have learned since March, and I think we've all have got more to learn for sure. But one thing I know that we have talked before we went on the air, and that is how we can stop the spread. Reiterate that for our listeners.
We often talk about the social distancing, the 6 feet, but what I encourage people to do is to wear a mask. Wear a mask not only to protect you, but to protect others, to protect your loved ones, to protect your family members, to protect your friends and neighbors. Just when not saying wear a mask all the time within your home, but when you're going out to different venues or to the grocery store or gas station, make sure that, or even your church, your place of worship, make sure you're cognitive to wear a mask at all times.
Well, we sure do appreciate you, LaShannon, you taking time and talking with us. I appreciate talking to a TV star now because I got to talk to someone that's been with the governor.
Sorry, not at all. I really appreciate the time, but more than anything, we are here. Community health centers are here, and we're, covering every corner of the state. And again, I would just encourage people to call the 800 number or visit our website and just know that we're here. Our health centers are staffed with board-certified clinicians, and we take pride in providing the best possible care, similar to that, what's available at a top-shelf private medical clinic within the areas as well.
I think this is one opportunity for all the healthcare professionals have all got on board, from the community health centers to the hospitals, even to UAMS and statewide, that they've all come together, and we're going to beat this thing. We're going to get it tested, and we are going to...
Absolutely going to beat this thing. This thing will make us more prepared for if there's that second wave or another pandemic. What it's taught us, we all must work together to address outbreaks. And again, thank you so very much. Thank you to all the healthcare workers that are listening or that have family members that are healthcare workers, but also thank you to the teachers, because we have not thanked the teachers, because the teachers actually had to make the necessary adjustment to put curriculum online. So thank you to our teachers, and thank you to the healthcare workers that are on the front line making the necessary sacrifices.
Okay, that number again is 833-508-0774. Also, you can go to www.chc-ar.org. LaShannon, thank you so much for taking time and talking with us.
Thank you, sir, and thanks for having me, and have a great day.